Vitamin K, class, oral root, parenteral root. Vitamins are intensifiers that you should have for development and well-being. They are required in just modest quantities and typically are accessible in the food varieties that you eat. Vitamin K is essential for typical coagulating of the blood. Vitamin K is found in different food varieties including green verdant vegetables, meat, and dairy items. In the event that you eat a fair eating routine containing these food varieties, you ought to get all the vitamin K you need. Little vitamin K is lost from food sources with common cooking. In case you are taking anticoagulant medication, blood thinners, the measure of vitamin K in your eating regimen may influence how well these drugs work. Your primary care physician or medical services proficient may prescribe changes in your eating routine to help these medications work better. Lack of vitamin K is uncommon yet may prompt issues with blood thickening and expanded dyeing. Your PCP may treat this by endorsing vitamin K for you. Vitamin K is regularly given to babies to forestall draining issues. This medication is accessible just with your PCP solution. This item is accessible in the accompanying measurement structures. Container. Tablet. Prior to using. In case you are taking a dietary enhancement without a solution, painstakingly peruse and follow any safeguards on the mark. For these enhancements, the accompanying ought to be thought of. Hypersensitivities. Tell your PCP on the off chance that you have at any point had any uncommon or hypersensitive response to prescriptions in this gathering or some other drugs. Likewise, tell your medical services proficient in the event that you have some other kinds of hypersensitivities, for example, to food sources' colors, additives, or creatures. For non-solution items, read the mark or package fixings cautiously. Pediatric. Kids might be particularly touchy with the impacts of vitamin K, particularly menadiol or high portions of phytonadione. This may build the opportunity of incidental effects during treatment. Infants, particularly untimely children, might be more delicate with these impacts than more established youngsters. Geriatric. Numerous prescriptions have not been tried in more seasoned individuals. Hence, it may not be known whether they work the very same way they do in more youthful grown-ups or then again on the off chance that they cause distinctive incidental effects or issues in more established individuals. There is no particular data about the utilization of vitamin K in the older. Pregnancy. Vitamin K has not been accounted for to cause birth surrenders or different issues in people. Nonetheless, the utilization of vitamin K enhancements during pregnancy isn't prescribed in light of the fact that it has been accounted for to cause jaundice and different issues in the child. Breastfeeding. Vitamin K taken by the mother has not been accounted for to mess up nursing infants. You should check with your PCP in case you are giving your child an unfortified equation. All things considered, the child should get the vitamins required some alternate way. Medication interactions. Albeit certain meds ought not be utilized together by any stretch of the imagination, in different cases two unique meds might be utilized together regardless of whether an association may happen. In these cases, your primary care physician might need to change the portion, or different safeguards might be important. Tell your medical care proficient in case you are taking some other solution or non-prescription, over-the-counter, OTC medication. Different interactions. Certain prescriptions ought not be utilized at or around the hour of eating food or eating specific kinds of food since associations may happen. Utilizing liquor or tobacco with specific drugs may likewise make collaborations happen. Talk about with your medical care proficient the utilization of your medication with food, liquor, or tobacco. Other medical problems. The presence of other clinical issues may influence the utilization of dietary enhancements in this class. Make sure you tell your PCP in the event that you have some other clinical issues, particularly cystic fibrosis or different infections influencing the pancreas or loose bowels, delayed, or gallbladder infection or intestinal issues. These conditions may meddle with the assimilation of vitamin K into the body when it is taken by mouth. Higher dosages might be required, or the medication must be infused. Glucose 6-phosphate dehydrogenase, G6PD, lack. The possibility of incidental effects might be expanded, particularly with menadiol. Liver infection, the possibility of undesirable impacts might be expanded. Appropriate use. Take this medication just as coordinated by your PCP. Try not to take pretty much of it, don't take it all the more frequently, and don't take it for a more drawn-out time frame than your PCP requested. To do as such may cause genuine undesirable impacts, for example, blood thickening issues. Dosing. The portion prescriptions in this class will be distinctive for various patients. Follow your physician's instructions or the headings on the mark. The accompanying data incorporates just the normal dosages of these medications. In the event that your portion is unique, don't transform it except if your primary care physician advises you to do as such. The measure of medication that you take relies upon the strength of the medication. Likewise, the quantity of dosages you take every day, the time permitted among portions, and the time frame you take the medication rely upon the clinical issue for which you are utilizing the medication. For menadiol. For oral measurement structure, tablets. For issues with blood coagulating or expanded dyeing, or for dietary supplementation. Grown-ups and kids, the typical portion is 5 to 10 milligrams, mg, a day. For infusion dose structure. For issues with blood coagulating or expanded dyeing, or for dietary supplementation. Grown-ups and young people, the typical portion is 5 to 15 milligrams, infused into a muscle or under the skin, a couple of times each day. Kids, the typical portion is 5 to 10 milligrams, infused into a muscle or under the skin, a couple of times each day. For phytonadione. For oral dose structure, tablets. For issues with blood thickening or expanded dyeing. Grown-ups and young people, the typical portion is 2.5 to 25 milligrams, mg, once in a while up to 50 milligrams. The portion might be rehashed if necessary. Youngsters, use isn't suggested. For infusion measurement structure. For issues with blood thickening or expanded dyeing. Grown-ups and teens, the standard portion is 2.5 to 25 milligrams, infrequently up to 50 milligrams, infused under the skin. The portion might be rehashed if necessary. For counteraction of draining in infants. The standard portion is 0.5 to 1 milligram, infused into a muscle or under the skin, just after conveyance. The portion might be rehashed following 6 to 8 hours if necessary. Missed dose. On the off chance that you miss a portion of this medication, take it as quickly as time permits. Be that as it may, in case it is nearly an ideal opportunity for your next portion, skip the missed portion and return to your standard dosing plan. Try not to twofold portions. Enlighten your primary care physician concerning any portions you miss. Capacity. Keep out of the scope of youngsters. Store the medication in a shut compartment at room temperature, away from warmth, dampness, and direct light. Keep from freezing. Try not to keep obsolete medication or medication as of now not required. Insurances. Tell every clinical specialist and dental specialists you go to that you are taking this medication. Continuously check with your medical services proficient before you start or quit taking some other medication. This incorporates any non-prescription, over-the-counter, OTC, medication, even anti-inflammatory medicine. Different prescriptions may change the manner in which this medication influences your body. Your PCP should check your advancement at standard visits. A blood test should be taken routinely to perceive how quick your blood is coagulating. This will assist your primary care physician with choosing how much medication you need. Incidental effects. Alongside its required impacts, a medication may cause some undesirable impacts. Albeit not these incidental effects may happen, in the event that they do happen they may require clinical consideration. Check with your primary care physician at the earliest opportunity if any of the accompanying incidental effects happen. More uncommon. Diminished craving. Diminished development or movement. Trouble in relaxing. Broadened liver. General body expanding. Crabbiness. Muscle firmness. Pallor. Yellow eyes or skin. Uncommon. Trouble in gulping. Quick or sporadic relaxing. Tipsiness or swooning. Windedness. Skin rash, hives, and additionally tingling. Growing of eyelids, face, or lips. Snugness in chest. Pained breathing as well as wheezing. Uncommon. Blue tone or flushing or redness of the skin. Tipsiness. Quick and additionally weak heartbeat. Expanded perspiring. Low circulatory strain, impermanent. Some incidental effects may happen that generally needn't bother with clinical consideration. These incidental effects may disappear during treatment as your body changes with the medication. Additionally, your medical care proficient might have the option to inform you regarding approaches to forestall or lessen a portion of these incidental effects. Check with your medical care proficient if any of the accompanying incidental effects proceed or are vexatious, or on the other hand in the event that you have any inquiries concerning them. More uncommon. Flushing of face. Redness, torment, or growing at spot of infusion. Skin injuries at the spot of infusion, uncommon. Surprising taste. Opposite incidental effects not recorded may likewise happen in certain patients. In case that you notice some other impacts, check with your medical services proficient.